On the day of surgery for your endothelial transplant, whether it be DSAEK or DMEK, there's a similar process. So please look at all the preoperative forms that we've given you and ensure that you have followed the fasting instructions before you come in. You'll arrive at the surgical center at the time that we've given you. You will be greeted by one of the staff members who will place drops in your eye. Next, you'll see an anesthesiologist who will offer you sedation. And if you need sedation, please take it. It helps to relax you and takes the edge off. You will receive an injection around your eye, followed by what we call a Honem balloon. This balloon helps the injection works and prevents your eye from moving during the surgery and freezes the entire area or anesthetizes the area so you don't feel pain. You may feel some pressure or pull, but no pain. They will escort you into the OR and you will lay down. We will clean off your eye, and then a white milky drape will be placed over both eyes. The eye that's covered, you just can close gently or blink normally. A clip or speculum will be placed into the eye that we're operating in. You may see 2 or 3 lights in the microscope, and if you do, just look in the center of them. You will notice some pushing or pulling, some changes just in sensation around your face. But a surgery with just DSAEK or DMEK takes about 30 minutes. A surgery with DSAEK and DMEK combined with cataract surgery can take about 30 to 45 minutes. After the surgery, we will put a patch on your eye with a shield and you will be escorted out of the OR flat. Why flat? Well, remember during the DSAEK and DMEK procedure, we put gas in the eye or we place in air. And so we need you to lay flat. By laying flat, the air is holding that new tissue in place against your cornea. They will give you a pill that you take to bring your pressure down. Or that evening, you'll take 3 to 4 more pills to keep the pressure down, and I will see you the next day. Remember, the goal is to stay flat as best as possible to give a chance of that new tissue sticking to yours. I'll see you in the office. We make sure that your pressure is okay. We make sure the tissue's attached. Then you follow our guidelines afterwards. Remember, limited TV, computer, reading, phone, limited screen time, but you're not going to be doing that because you're going to be laying flat. I may see you in 3 days, or I may see you a week later, depending on how you look on the first day. And then if we're looking at visual results, as I mentioned in an earlier video, really 3 to 4 weeks is what we're looking for the improvement with DMEK and DSAEK. And then we don't get new glasses or contact lenses for about 3 months because your tissue is changing, it's improving, it's getting clearer, and we don't want to get glasses or contact lenses too early because they'll change. So we wait 3 months before we do that, and then I see you continuously every 3 months for the first year. You will be using drops. We give you a drop schedule, and you will notice that they taper over time. We will stick strictly to those drops because you have received tissue from another person. We don't want your body to reject the tissue. So it's important that we follow all of the post-op instructions to the T so you get the best chance of getting the best vision possible and having these transplants last, hopefully, for the rest of your life.